Okay, so good morning, everyone, and thank you for joining us for the launch of our Mayor's Wellness Campaign Mental Health Toolkit. I am Adelisa Perez, Director of Quality at the New Jersey Healthcare Quality Institute, and I oversee our Mayor's Wellness Campaign. Before we get started, I wanted to go over a couple of housekeeping items. There we go. All phone lines will be muted for the duration of the program to limit any background noise. This webinar will be recorded and posted on our website after the presentation. And we encourage you to ask questions by typing them into the chat box, and we will try to answer questions as we receive them, but otherwise we'll get to your questions at the end of the presentation. So to get us started, by the end of today, you will learn what mental health is and how it affects our residents, how to leverage your Mayor's Wellness Campaign to address mental health in your community, resources to support residents who need access to mental health services, and how to utilize the new toolkit in your community programming. Before we get started, I wanted to provide a quick overview of the Quality Institute to give you a sense of who we are. The Quality Institute is a multi-stakeholder nonprofit organization. We believe that collaboration is essential to improving our healthcare system, so we convene healthcare and community leaders in New Jersey around the common goal of improving the safety, quality, and affordability of healthcare for everyone. Our work falls into four main buckets: quality improvement, policy, education, and community health. The Mayor's Wellness Campaign is our statewide community health initiative in partnership with the New Jersey State League of Municipalities. Now in its 16th year, the Mayor's Wellness Campaign provides mayors and community leaders with tools and guidance and resources to improve the health and wellness of their communities. The program is dedicated to addressing social determinants of health through community-based programs and interventions. We are proud that we are going strong with 422 communities participating. Throughout the year, Quality Institute staff work closely with mayors and community leaders to organize a Mayor's Wellness Campaign committee, identify their top local health needs, plan and implement programming that addresses those needs, and develop ways to evaluate their efforts. We also offer virtual education workshops led by health leaders and experts on identified community health priorities and emerging issues, and bring together community leaders to collaborate and share best practices. With the Mayor's Wellness Campaign, mayors have the platform and tools they need to make their community a healthier place to live, work, and play. We ask all Mayor's Wellness Campaign towns to sign an annual pledge of participation to show their ongoing commitment to health and wellness in their community. So if your town is not yet part of the Mayor's Wellness Campaign, or if you haven't signed your pledge in a while or for 2022, we encourage you to do so today. The pledge can be found on the Mayor's Wellness Campaign website, and I'll also include a link to the pledge in a follow-up email after today's presentation. Once you sign the pledge, Quality Institute staff will reach out to provide you a copy of your pledge and connect with you about our Mayor's Wellness Campaign program and how we can support your efforts. The pictures you see on this slide are from some of our Mayor's Wellness Campaign towns. On the left is Patterson's first annual Green Fair. In the middle is Bergenfield Mayor's Wellness Campaign's Walk with a Mayor. And on the right is a farmer's market in Wildwood Crest. Every year, the Mayor's Wellness Campaign conducts county-wide town hall meetings, which are our focus groups in all 21 counties with mayors and community leaders to collect data on pressing local health needs and community challenges and barriers to inform relevant and innovative program development. During our town hall meetings last summer, we asked community leaders to share their experience dealing with a pandemic on the local level and to identify their concerns going forward to manage the pandemic. The top areas of concern were food insecurity, social isolation of older adults, residents' mental health. In response to these needs, the Mayor's Wellness Campaign developed and launched new programs and tools, and we conducted a virtual education session in partnership with the Community Food Bank of New Jersey to discuss strategies communities could implement and how they could leverage their Mayor's Wellness campaigns to address food security. Additionally, we highlighted what Mayor's Wellness Campaign towns were doing to combat food insecurity as a way to spur new ideas and share best practices. We also released a Mayor's Wellness Campaign social isolation tool to help communities implement a volunteer-based program to match volunteers with older adults in their community to increase social connectedness. Mental health was a primary concern in all 21 counties, and the pandemic really exacerbated an already existing problem, the rise of people experiencing mental health issues across the state. Municipal leaders expressed the need to learn more about mental health and substance use topics, how to approach these difficult conversations, with residents experiencing mental health challenges and local resources available to residents in need of mental health services. Towns were requesting information on mental health programs and initiatives that their local mayor's wellness campaigns could implement. In response, with generous support from the Horizon Foundation for New Jersey, the Quality Institute created a comprehensive Mayor's Wellness Campaign mental health initiative. So our Mayor's Wellness Campaign mental health initiative included 3 components. One component was education and training for community leaders and residents to increase their understanding of mental health issues. So through the Mayor's Wellness Campaign, we offered mental health first aid trainings to community leaders, municipal staff, and Mayor's Wellness Campaign committee members and volunteers. These trainings teach participants how to assist someone experiencing a mental health crisis, how to identify risk factors and warning signs for mental health and addiction concerns, and provide strategies for how to help someone in both crisis and non-crisis situations. Participants reported increased knowledge about mental health and stigma, and increased knowledge on how to support someone experiencing a mental health challenge. Our Mayor's Wellness Campaign initiative also focused on outreach and support to one community to assist them with the implementation of a mental health program for their residents. So Quality Institute staff worked closely with the City of Long Branch to develop and support 2 mental health focused programs in their community center. One was an interactive educational workshop for youth where they learned about mental health, stigma, and community resources to support someone experiencing a mental health crisis. Participants also learned about emotional self-awareness and how to manage their feelings. The Quality Institute supported this initiative, and we were able to connect Long Branch to Preferred Behavioral Health, a leading behavioral health care organization in central New Jersey who led this event. Long Branch also held a yoga program led by a local business owner and included a discussion on the use of yoga and mindfulness to improve mental wellness. Participants ranged from youth to older adults. So participants from both events reported an increased understanding of mental health and stigma, an increased awareness of community prevention and support resources. And due to the success of these programs, the yoga instructor is donating additional classes to the community center, and Long Branch and Preferred Behavioral Health Group are exploring additional opportunities to collaborate. And the last component of our initiative was the development of the Mayor's Wellness Campaign Mental Health Toolkit. As I mentioned earlier, a top priority for our communities was mental health. They asked for resources to increase their own knowledge about mental health and information on programs and strategies they can implement in their community to support the mental health needs of their residents. This toolkit will help communities do just that. The toolkit provides education, guidance, and resources to address mental health at a local level. I'm going to walk you through the toolkit to give you a better sense of its contents and how you can address mental health needs in your community. But you'll also hear from healthcare experts and communities who have implemented the types of mental health programs highlighted in the toolkit. So section 1 is an introduction to the toolkit. Here you will find a brief overview of the Mayor's Wellness Campaign, a link to our Mayor's Wellness Campaign handbook, which is a step-by-step guide for towns to help them start a local Mayor's Wellness Campaign in their community if one doesn't exist, or to help them expand and enhance an already existing Mayor's Wellness Campaign. This section also describes the intent of this toolkit, which is really to provide basic education on mental health, an overview of common mental health issues, to showcase strategies and program ideas that you can implement to address mental health locally, and to highlight resources that mayors and community leaders can share with residents. The toolkit will help communities engage residents on this important topic, as well as support those in need of mental health services and support. Section 2 of the toolkit focuses on mental health basics, such as defining what mental health is and discussing common mental health illnesses. Joining us today is Dr. Tara Chalakani. Excuse me. She is Deputy Chief Executive Officer of Preferred Behavioral Health Group, which is headquartered in Ocean County and provides programming in 11 New Jersey counties. Preferred Behavioral Health serves over 30,000 people each year in over 70 programs that encompass traditional outpatient and intensive outpatient programs, prevention programs, school-based services, residential services, case management, justice-involved service, and integrated care. Tara's diverse experience in healthcare and behavioral care, healthcare has spanned more than 30 years. So I'm going to actually stop sharing my screen so that we can see each other. There we go. And Tara, I wonder if you can help us get started by providing us an overview of what mental health is and why mental health is important.
Absolutely. And thank you, Adelisa, for having me today, and the New Jersey Healthcare Quality Institute for bringing this to everyone's attention and putting my passion and the passion of Preferred Behavioral Health Group on the map, because we need to have more discussion about mental health and mental health disorders. So when you posed the question to me, what is mental health? I thought to myself, once we remove the qualifier of mental and just focus on health is really when we can truly understand the nature of mental health, because there is no true separation of our heads from our bodies, right? So what's ever going on mentally impacts us physically and vice versa. So to understand mental health is to know that it is inclusive of our physical health, that it impacts our whole body, and it isn't only just our emotions, because like I said, they're all interconnected. And I think, that we live in a society where we don't hesitate to access care for medical issues. If we break a bone, we're going to go to the emergency room. We're going to get a cast put on our arm. If we have an ear infection, we'll go get an antibiotic. But when people are struggling and truly, truly struggling, that sometimes living is an effort, there is hesitation and not even a thought to access mental health care. So I just want to discuss some numbers that pre-COVID, 1 out of every 4 adults had a diagnosable mental health disorder. 1 out of every 5 children had a diagnosable mental health disorder. The World Health Organization now says post-COVID, that has gone up by 25%. But for myself and anyone on our meeting today who deals directly with mental health, it feels like so much higher than that. We can't even meet the demands of our communities and their mental health needs. So Preferred Behavioral Health Group is a trauma-informed organization. And the simplest definition of that is we embrace everyone that walks through our doors, staff, clients, family members, knowing that they have been impacted by trauma. So our approach is very gentle. It's warm. We promote safety, like you were talking about, in communities, the health and well-being of our staff and our clients, because we know that everyone walking through our doors that has a diagnosis, the statistic is that 90% of them have experienced trauma. So if we look at COVID, the circumstances of COVID, the social isolation, the fear, the loss that people experienced, whether it was their life, someone else's life, their job, their lifestyle, all of that impacts our mental health. So when we look at mental health, we need to understand that it isn't for a very specific population, that it really impacts us all, and that includes substance use disorders. So I hope that helps answer the question and start the dialogue off this morning.
Yeah, and I really love that you that first opening comment was about removing mental from mental health and really just focusing on health, because it is an important component in the whole picture that we really need to be looking at. It impacts all aspects of our lives for everybody. So that was a great point to kind of kick us off with. I did want to follow up because there are so many different conditions that are recognized as mental health challenges. It might be helpful for folks to hear what are some of the more common mental health illnesses, either in general or maybe perhaps here in New Jersey.
Sure. So I think it's really an across the board answer. The statistics are the same in the United States as they are globally. That anxiety, depression are typically the top 2 mental health diagnoses. They kind of jockey for first and second place, and depending on who's counting and what's going on in the world. But the bottom line is that they really coexist as best friends. They typically, really depressed people are usually a little anxious or a lot anxious, and very anxious people are usually a little depressed. So those are the 2 biggies. And, the one thing that I try to teach my clients and students and anyone that I come in contact with is that depression and anxiety look different on different people. So sometimes I'll hear things like, oh, well, they can't be depressed because they did this. They went to a concert on Saturday night, so it doesn't necessarily mean you're not living or you can't enjoy things, but maybe you're not sleeping. Maybe your appetite is off. Maybe you're irritable. Maybe you have negative thoughts that run on a loop in your mind all day and all night. Maybe you're constantly worried, so it looks different. There's so many symptoms, there's so many different presentations. And I think that the more we have discussions like this, the more we educate ourselves, the more, we can really recognize mental illness. I know many communities have done a lot of training with grants and mental health first aid. And that's amazing because, we learn how to treat a cut or a bruise, but we don't learn how to talk to somebody when they're struggling, and there still is fear. And I know that Shelby's going to talk about stigma. So, we do live in a world of stigma. People don't want to get close. They don't want to see that side of humanity maybe, but it exists. And the more we familiarize ourselves with it, and the more comfortable we get talking about, who our therapist is as we are, who's giving us a facial or cutting our hair, the more people will get the help that they need.
I know I'm jumping ahead a little bit here, but while we have you, it would be great just to hear your thoughts on how communities can collaborate with local providers to address mental health, because that's such an important component, is that communities often want to support their residents, but don't have that knowledge themselves to do so.
Sure. I mean, well, obviously, this is an excellent platform to get educated and grab some resources that you can bring back. But, I would say that wherever you can have representation, if you're going to have a town hall meeting, bring someone in from the community, educate your elected officials and your community members that are present. I think it's also really important to have a presence in schools. So many times children's mental health needs are dismissed and marginalized by their parents, by their teachers. And that's where they're spending the most of their time. And they're our future, right? So we need to invest in children and really get them to be savvy about mental health and give them the resources that they need so that as they, age and become tax-paying citizens of these towns that we're trying to address, that they're more educated. So I do feel strongly that the youth really need the attention. And when we look at statistics, especially post-pandemic, I mean, the children's mental health needs are astronomical. And, there's a very public statistic that the suicidality in adolescent girls is up 51%. And, I was recently working with a young person who attends a school and was just depressed and can't handle the amount of work. And, I was trying to work with her to talk to her teachers, and she said they won't understand and no one cares. And I mean, it broke my heart. And we can't have that. We really can't have that. And there's a saying, right, that parents are happiest as their unhappiest child. So let's work with those kids, because there's a trickle down effect to the parents, because if the kids aren't struggling, then parents won't be struggling to get them help. And, so it really is a snowball. So I would say that's a biggie. Get into the schools, talk to parents, you have a big audience there in any community to really address these things with.
Well, thank you. We appreciate your insights and the overview that you provided on mental health. And I think it'll be a great segue into the rest of our conversation today. So I'm going to go ahead and share my screen once again. Okay. And talk about section 3 of our toolkit, which discusses how to leverage your Mayor's Wellness campaign to address mental health in your community. Communities across the state provide access to healthcare, physical health interventions, social cohesion, nutrition, and education through their local Mayor's Wellness campaigns. Mayor's Wellness campaign programming includes things such as exercise classes, food pantries and farmers markets, and critical health screenings. The same framework can be used to address mental health in your community. It's important to first identify what the mental health needs of your community are. So there really are several ways that you can collect this information. You can hold town hall meetings to hear from residents about mental health issues and needs, conduct a community survey, or connect with local mental health providers or your local health systems to learn about the needs in your community. Quality Institute staff can help you connect with local providers in your community or help you develop community surveys that you can implement yourself independently. Mental health stigma can make mental health worse. We heard Tara talk about that a little bit this morning, but there are many steps community leaders can take to address mental health stigma in their towns. So to talk with us more about mental health stigma, joining me is Shelby Klein, Director of the Division of Mental Health and Addiction Services under the Bergen County Department of Health. In her role, she leads efforts to assure that all residents have access to mental health and substance use care through planning and oversight, system coordination, public education, and advocacy. Shelby has over 20 years working in nonprofit settings, with most of her career spent working with Care Plus New Jersey, a behavioral health organization based in Bergen County, where she was the Senior Vice President of Development. She helped conceptualize and gain funding for a wide range of cutting-edge initiatives, such as integrating primary and behavioral healthcare services, and the establishment of behavioral health homes and certified community behavioral health centers. Both her bachelor's and master's degrees are in the field of social work, which provides her a global perspective of community needs, policy impact, and solutions. So once again, I'm going to stop sharing my screen here. So Shelby, I'm excited to have you with us today because there are a lot of counties and local communities that are already implementing stigma-free initiatives across the state, and Bergen County was really a leader in that effort. So maybe you can start us off by explaining what mental health stigma is and how it impacts mental health.
Sure. Thank you. I'm honored to be included in this discussion this morning as a longstanding community advocate, and thank you for allowing me to share my knowledge and resources during this very timely conversation today. So mental health stigma exists in multiple forms. Some examples include self-stigma, public stigma, and institutional stigma. They're not the only types that exist, but I'll talk about each of those a little bit more. And I also want to acknowledge that culture also impacts stigma in the community as well. So self-stigma centers around feelings of shame or a negative attitude of one's own mental wellness. Nature and nurture both impact self-stigma. Culture, as I mentioned before, because the individual feels shame, they are more likely to isolate themselves and not seek care. They may not recognize that there's hope for recovery versus lifelong challenges. And, because of whether it's denial of illness or unawareness, cultural factors, but all those things exacerbate shame, and ultimately they can negatively impact a person's recovery and their ability to really engage in society and life to their optimum ability. Public or social stigma centers around expressions of negative depictions of people with a mental illness or prejudiced attitudes towards them. It's rooted in a real lack of understanding by family, friends, co-workers, and the public in general. It's often characterized as blame versus support, to engage with supports. As Tara was mentioning, the schools or the families, they need to understand what's happening with kids so that they can support them and not say, oh, just get out of bed. It's not a big deal. It's, just manage your time better. Oh, it's the hormones, or whatever excuse it may be, to really understand some of what's going on. This has improved over the years, especially with the celebrities and sports figures really talking publicly about some of the mental health struggles that they've dealt with and how they've dealt with them. But many people still will characterize a person with a mental illness by their illness, right? So language becomes important, such as we tend to say, oh, they're schizophrenic. No, it's a person with a schizophrenia diagnosis, right? We don't call a person, oh, they're cancer. it's a person with a cancer diagnosis. So changing language like that becomes very important in that public and social stigma area. And the stereotypes are still ones of as being unstable, potentially dangerous, intellectually inferior, things like that, which really are, the data shows the opposite as factual. So again, getting that information and awareness out becomes critical to addressing that type of stigma. Institutional stigma is really about how systems contribute to stigma. So mental health parity has been a struggle over the years. So insurance coverage, as an example, there's limited access to provider panels. There's limited sessions allowed for treatment. Sometimes there's burdensome prior authorization processes. Medication formulary limitations might limit access to certain medications for some people. And low reimbursement rates to providers limits the number of people who might be willing to accept insurance or treat the under or uninsured residents in the community. So we need to look at, and progress is being made, but continue to advocate in those areas. And as I mentioned, these stigmas stem from a lack of awareness, lack of education, lack of perception about the nature and complications of some illnesses, such as, why is that odd behavior? Why is that child acting out? What is it really a reflection of? We don't want to just look at the tip of the iceberg, but everything that falls underneath that and contributes to that iceberg. All types of stigma contribute to barriers to recovery, from getting the help and supports that contribute to what we call, a positive recovery and mental wellness, right? We all have mental health. It's about where we are with our mental wellness at any given point in time in life. Ways that stigma can impact the lives of people with mental health problems. Besides the isolation component and some of those areas that were previously discussed, one of the most alarming facts that I am aware of is that it takes about 11 years from the onset of symptoms to treatment engagement. And one of the reasons for this is that symptoms usually develop during adolescence. We make excuses as to why and how in school and hormones and everything else that's happening in life. But that's 11 years of frustrations, added emotional stress, potential isolation, potential danger to them, to self. You see some self-harm even happening. Diminished self-esteem, lost employment, lost education opportunities, lost career opportunities. So, what's very important in talking about stigma is recognizing the facts and engaging in treatment so that people can recover with the supports they need as early as possible.
Thank you. And I think you provided a great overview of how exactly mental health challenges and stigma can impact, our overall health. I'm really talking about individual steps and actions that we can take. Both you and Tara highlighted, listening, active listening, really hearing what folks are saying about how they're feeling and struggling, as well as language that we can use individually. So I think we can also, it would also be helpful to talk about what communities can do to address mental health. And I know becoming a stigma-free community is one way that they can address mental health stigma. Can you talk to us about what the goal of a stigma-free campaign is, and maybe what are some stigma-free activities that towns can implement?
Sure, happy to. So the goal of being stigma-free is to raise mental health awareness, which in turn can help people understand their own symptoms, the symptoms of others, result in connecting to professional treatment, and perhaps most importantly, reduce the number of people of suffering in silence or in isolation, right? It's creating a culture where residents feel supported by their community and neighbors and feel free to seek treatment, to talk about their mental well-being publicly. Without the fear of being stigmatized, without the fear of kind of being isolated by family and friends in that process. The consistent brand of stigma-free, the rectangular logo, the use of the lime green color that represents mental health awareness, that's important to the stigma-free campaign because it's a visual, that has now gone pretty much statewide, that connects people and raises that awareness statewide, that to have these conversations and talk about what does it mean. However, to be stigma-free, it's always intended to be unique and organic to the community. There is no prescribed way of being stigma-free, right? It's always unique to the community. So, the movement of, if there's an organized committee or task force or other entity that provides residents to become involved in their community, create opportunity for different stakeholders, as you mentioned earlier, Adelisa. It's about collaboration. It's for different stakeholders to come together, creatively implement local activities that work in their community, that fit with their community, and importantly, ensure information is readily available about local resources. And I know your toolkit, as well as some of the toolkits that the county has created in the past, is a great way for towns to understand what resources there are, because there's a mental health administrator in every county in New Jersey. I'm the one for Bergen County, but they are a great resource of connecting with those local providers as well. And while like an official declaration of being stigma-free is not required, it's encouraged as recognition of the prevalence of mental illness and importance to promote those conversations. And we provide templates to schools, to municipalities, to local governments, to other states even, to use to formalize that recognition. And it can be, hospitals, businesses, faith-based institutions. They can all declare themselves stigma-free and formally document that. And it's a way to just echo that commitment. The movement did start in Paramus in 2013, which is now almost 10 years ago. And it did spread across New Jersey over the past decade. Most recently, Burlington County declared themselves stigma-free, and we were more than happy to provide logo assistance, toolkits, and information with them to help them get to that place. In relation to examples, both Adelisa and Tara have mentioned the mental health first aid trainings. We also think that's a great tool for communities to tap into, especially since right now there are a variety of grants out there where you can find somebody to provide that training fairly easily, including through the Quality Institute. And suicide prevention trainings, we also highly promote as well. We want people to be comfortable with saying, are you thinking about killing yourself? Not hurting yourself, not harming yourself, but are you thinking about killing yourself? That's an important thing. And some of the activities for stigma-free initiatives have included things ranging from annual county symposiums to schools having lime out sporting events where the teams had some lime green represented in uniforms or accessories and when they played each other. Libraries displays during Mental Health Month, lawn signs, t-shirts, walk events, self-care focused events like Tara had mentioned, raising stigma-free flags, distribution of promotional items at local events, film screening events, author events, permanent signs you see around at least Bergen County. I've seen them in other counties as well. Most recently, we did a sticker design contest here in Bergen County. So again, it really becomes organic to the community, and it's not necessarily about creating something new, but tapping into what's already happening in those communities as well.
And I know I only have another quick minute with you, but it would be helpful if you have any advice. Our number one question that we get from communities is really, especially our smaller communities that feel like they don't have resources to implement these initiatives. And I know Bergen County has communities of varying sizes. Any advice or strategies you can give them about how they can go, implement some of these initiatives?
Yeah, I think the emphasis is about collaboration and leveraging resources. So I live in one of those small towns with no budget for stigma free. And we fairly early tapped into or found Mayor's Wellness, and they had a tiny budget. So we learned how to collaborate and tap into different resources in the community. And while some towns around us were really pushing lawn signs and T-shirts, we didn't have that budget, but we made bookmarks and pencils and smaller items that we could get strategically into the hands of different people in the community. And, really emphasizing the collaboration. We had a small working group, but with very different perspectives and contacts in the community. So one person was also connected to Rotary. Another person was connected to the largest faith-based entity in the community. We had a school representative. We had a law enforcement representative. So it was about, coming together and talking about what each of us were seeing and could do in our existing capacities, and tying it back to some things that already existed. So if the school was already doing an educational event, it was about just tagging the logo on. There was no cost, no exposure, but it was putting that logo there as a reminder of the stigma-free movement and having a table of resources present at the same time. So there was a lot of creative, low touch, low involvement, time, money that can be done, that's organic to things that are already happening in the community.
I would encourage towns, as you're thinking about who in your local community that you can partner with for some of these actions that Shelby and Tara are talking about. A lot of towns also partner with neighboring communities. So sometimes if you can't find that support or those resources within your own, border, I'll say, you can definitely look to your neighboring communities who are likely also interested in implementing some of these initiatives and can help you, get some of that work done. We did receive a question about where the stigma-free toolkit is located. We did in the mental health toolkit include links to quite a few of those stigma-free toolkits, including Bergen counties and a few other counties. They have great resources, so I would encourage you to definitely check out those links in our toolkit. Okay, and with that, I think it's another great segue to our next section. So let me just pull this up again. So again, Mayor's Wellness campaigns and other local communities are a perfect fit for implementing stigma-free campaigns and initiatives to really support people experiencing mental health challenges and help communicate that your community is a safe space for all residents and values a culture of health and wellness. Part of what fuels mental health stigma is a lack of understanding and education about mental health. And again, there are many ways communities can help educate their residents about the importance of mental health and mental health challenges through their Mayor's Wellness campaign. So Section 3 also includes a focus on community education. One way is, as we've been talking about, is mental health first aid trainings. And again, just as a reminder, mental health first aid teaches you how to help someone who is experiencing a mental health challenge. It teaches you how to identify, understand, and respond to signs of mental illnesses and substance use disorders. And you can offer these trainings to a specific group of people, such as your staff, community leaders, such as elected officials, librarians, police officers, or to the public. Anyone can attend, including parents, grandparents, other family members, volunteers, or other caring community members. The Quality Institute will continue to offer free mental health first aid trainings throughout the year to community leaders, municipal staff, and our Mayor's Wellness Campaign committee members and volunteers. But as Shelby highlighted, there are so many organizations across the state that are offering these trainings as well. Communities can also partner with their local health systems or mental health professionals to provide community education. We have been discussing a little bit about how this relationship can look. Another example is that the Mayor's Wellness Campaign partnered with Evesham Township and Cooper University Healthcare to host a virtual education session, much like this one today, about the psychological impact of COVID-19, and had mental health experts available to answer residents' questions. The Quality Institute can help you connect you to experts in your local community to co-host similar events. Yoga, meditation, and mindfulness have been shown to improve one's mental wellness. And like we spoke about earlier with the City of Long Branch, you can offer these classes to your residents through your Mayor's Wellness Campaign by working with local business owners. And lastly, there are many additional initiatives happening across the state. We regularly share program ideas in our Mayor's Wellness Campaign newsletters and our social media channels and our webinars and at our Mayor's Wellness Campaign panel during the League of Municipalities conference. We encourage you again to reach out to neighboring towns to see how they're addressing mental health in their community and discuss opportunities to collaborate. The toolkit includes a couple examples of initiatives other Mayor's Wellness Campaign towns are doing, such as Norwood, who created a canvas of hope where residents could post messages of resilience and hope during a time when individuals were struggling, which is the picture that you see on this slide. Joining me today to talk more about mental health initiatives happening in his community is Mayor Richard Rigoglosso of Garfield, New Jersey. Mayor Riggs, as he's known to his residents, is passionate about his community and strives daily to revitalize and redevelop the hidden gem of Bergen County. He was a health teacher for the Garfield School District before becoming vice principal of Garfield Middle School in 2012, where he was most proud of his work in bringing the community and school together. In addition to his current role as mayor, Mayor Riggs serves as the principal of Garfield Middle School. As a lifelong resident and principal in Garfield, he understands the importance of quality of life and made that a high priority of his winning campaign. So once again, I'm going to stop sharing here so we can see each other. And Mayor Riggs, thank you again for being here today. During the pandemic, Garfield implemented an initiative called Happy to Chat. Can you tell us about this initiative and why you decided to implement it in Garfield?
Yes, first of all, thank you. I'm honored to be here. Yeah, I am a middle school principal, as well as the mayor. The Happy to Chat benches was brought on from basically during the pandemic. There was a lack of social connection going on in our city. Everybody was locked down, locked in, and there was nothing going on. And when we finally started to open up, you know, we have a couple of nice big parks in the city of Garfield. And one day, just reading a newspaper article, they talked about these benches. You know, back in the old days, I'm a kind of an old school type of thinker. And back in the days when you would sit at a bus stop and you would sit there and you're waiting for the bus and someone was sitting next to you, you end up getting into these conversations and you just talked about it. Then you get on the bus and you go your way. So basically, the Happy to Chat bench came along with that idea. We put a couple of benches, or the Adirondack chairs, we should say, around our park where you could just sit there. And if you're sitting there, there's a little sign up there that says it's Happy to Chat. You know, sit down there, someone will sit next to you and you guys could talk about your interests, hobbies, habits, or whatever, or just sit next to someone. And that's how it kind of evolved. Has it been working? The data shows, and there's not much data on it, but the data shows that people are sitting at the bench. We don't know what they're talking about, but it has a positive impact in our community. It has a positive impact in our park. We do find that our senior citizens are the ones who are sitting at these Adirondack chairs more than, and that's who we're probably reaching out to, because in the daytime, that's who's walking around the parks. They're the ones sitting there, and you know, they got something to share. They're in the same time frame, the same age, the same demographics. So they sit around there, and we find out it's actually working with our senior citizens, and that's who we probably were gearing it to, without knowing that we were actually gearing it to. That's what that's what the Happy to Chat benches or Adirondack chairs are all about.
And you were talking to me a little bit about how important evaluating all the initiatives that you guys put in place is for you to really understand like what's working and what's not working. Can you tell us any lessons that you have learned, how you intend to maybe improve the initiative?
Yeah, well, that's the whole thing. It's, when you come from a small city in Bergen County, population-wise, we're not so small, but, size-wise, we're very congested. It's tough to gain the data, as well as, panelists were talking about the funding behind everything. Everything has a cost. And being in the school district as well, SEL is a big part of our school now, ever since this pandemic was going on there. And I get better data, and I kind of turnkey it over to the municipality, because the municipality has a hard time achieving this data. So the things that we find out that work well, we start out in the school district, at least in my middle school. That's probably the biggest thing that's going on right now. We talked about the girls having issues, the stigma, everything evolves around mental health. If you have poor mental health, or, when I used to teach health, be low self-esteem, it affected your mental health and it affected your day. And it was always tough to find that out. One of the things that we found out is that there's too much promotion on poor mental health, not enough on the good mental health. And if you remember, I don't know if you may be too young, or everybody I say who are on here, everybody may be too young. But back in the day, they speak something called a Steered Straight program, which was, I believe, a big failure and everything like that. Because everybody geared, like, let me scare this kid who's having issues in life. Let me scare this kid that, this is what prison life is. And they go to prison and they sit there and all these inmates yell at you, scream at you, and tell you everything. A big failure. If you ever find the data, you find out that these kids end up in prison. But no one ever took these kids and brought them to something that was positive. And, like, this is where your life could be if you do just positive things. So it's about promoting better health, improve your body, get enough sleep, clean clothes, surround yourself around good people. These are the things that promote good mental health. And if you promote that, then, just by, just promoting that, everything will evolve around that. And you will know how to deal with that stressful day. When you have poor mental health, you have that stressful day, everything is going wrong. So the data that we find out is that when we promote good mental health, and it's only through our students and our families. When we promote our parents and they come to our school for events and activities with their kids, for promoting mental health at these activities, we find out that everybody's happy and go lucky. When they get home, it may be a different story, but at that moment of time, it's a good day. So,
and since you're talking, Mayor Riggs,
positive mental health.
And since you're talking about positive mental health, it would be helpful, or it might be nice to just quickly touch on another initiative that you guys have going on about connecting students with older adults. It's somewhat similar to what, the strategy we have in our social isolation kit. Can you just really quickly tell us about that initiative, how it works? And I know you've had to made a change since the pandemic happened.
It really has made a change. We have our students in the middle school. They go to the senior buildings in our town, and we have 3 big senior buildings for about 600 seniors. They live there. They're socially isolated. They can't get out. They have lack of transportation to move around. So we bring our students there, and we find that the senior citizens, they love telling the stories of the old days to them because they have no one to talk to, but they love telling these stories to our students. And our students, and we kind of pick and choose our students. We find the students who are struggling in school, and a lot of the struggles have something to do with home life. And we bring them there, and we find out that these students love hearing these stories. And they come back and they're excited about it, and they look forward to going to the next day. So we kind of connect our seniors with our youngest students, our 13 and 14-year-old students. And they go on a regular basis, and they actually look forward to going to meeting them. It's almost like a big brother, big sister. It's almost like adopting a grandparent, but it's someone positive in their life. We find that the seniors ask for these students. They share stories. They share, they actually even cook together. So it's a great little initiative that's been going on, and we're just going to keep promoting it more and more because we find out it's positive. It's something positive in their life. We find out that when our residents or our students have something positive going on, your mental health is a lot better than it was when you woke up that day.
Well, thank you. We appreciate you giving us some insight into what's happening in your community. And all of our speakers today have really been talking quite a bit about things that we can implement at a community level. But I do also want to talk about the importance of when someone is experiencing a mental health issue, that one of the most important steps is knowing where to go for help. So the toolkit includes additional resources that you can share on your community website, your social media platforms, or in your community spaces like your libraries, community centers, areas where your residents are gathering, so that they're aware of where to go for help and can access crucial mental health services in a time of need. During the pandemic, A lot of towns started hosting regular calls or video messages to keep residents up to date and share COVID-19 information. Many towns, such as Woodbridge Township, have continued to hold this outreach and have since expanded to share additional resources and upcoming town events. This is another great opportunity to share information about mental health resources. So we encourage you to share these resources with municipal employees as well, so that they can familiarize themselves with them and be able to provide information and referrals to residents looking for help. So resources in section 4 of our toolkit include contact information for the major crisis hotlines, including New Jersey's suicide prevention line, NJ Hope, and New Jersey's substance use disorders line, NJ Connect, as well as the national suicide prevention line. Every county, as you've heard today, has a dedicated screening service for psychiatric emergencies, crisis intervention, and information and referral. So we've included the contact information for each county. And then each county also has a county mental health administrator and a county alcohol and drug abuse director that can provide assistance to local services. And so we've included the contact information for those individuals as well. We recognize that these resources in the toolkit is not an exhaustive list. There are many additional mental health services, professionals, and organizations throughout the state. The resources included in the toolkit are a good starting point to help point you in the right direction, but we do encourage you to also research and connect with local providers in your community. We are here to help you in your efforts to implement mental health programming in your community through your Mayor's Wellness Campaign. Quality Institute staff can assist with helping you to create your education or awareness campaigns, connecting you with community organizations and local experts to support your work and collaborate on programs, helping you create evaluation surveys and tools to measure the impact of your program, and providing mental health education to community leaders and residents. Thank you again to the generous support of the Horizon Foundation for New Jersey. And we're also excited to announce that the Mayor's Wellness Campaign's mental health initiative will extend throughout the rest of this year and early next year. So additional activities that will be offering include even more adult mental health first aid trainings statewide, again, to community leaders, municipal staff, and Mayor's Wellness Campaign committee members and volunteers. We'll also be offering youth mental health first aid training for adults who regularly interact with young people, such as teachers, school staff, parents, family members, caregivers, and other residents. Youth mental health first aid teaches you how to help an adolescent 12 to 18 who is experiencing a mental health challenge or crisis. Feel free to reach out to us if you're interested in participating in an adult or youth mental health first aid training during the summer or later this year. We'll also be conducting statewide data collection on issues around mental health and stigma through our county-wide focus groups. And we'll be providing support to 3 Mayor's Wellness communities to implement mental health programming for their residents, much like the work that we did with Long Branch. In June, the Mayor's Wellness Campaign will launch a call for applications for local Mayor's Wellness campaigns that are interested in implementing mental health initiatives in their community. We'll work closely with the selected Mayor's Wellness Campaign towns to identify the mental health needs of their community and support the planning, implementation, and evaluation of mental health programming that addresses those needs. So with that, at this time, you can ask questions by typing into the chat box, or you can raise your hand by clicking the raise hand in the webinar controls. I'm going to stop sharing here. I did actually receive a couple of questions pre-registration. So I thought I would just kind of start us off with those. One individual said that as a parent with a young adult with mental illness, they often feel like they're on their own and really need tools to help our children. I know Tara, Shelby, everyone was kind of talking about this today. Where can they find more information on specific to youth and how they can help support their children who may have a mental illness? You know, how do they find support groups or therapists that specialize in this?
So I can take that one. I mean, there's numerous, I think, outlets for information. So, I mean, first and foremost, if someone does have healthcare insurance, they can always call their insurance company and be linked to providers in their community. For parents whose children have pretty acute or more intense needs, Perform Care New Jersey, performcare.org is a statewide hub that funnels calls by county for parents. So if they're in crisis, they can have someone through mobile response come to their house within an hour And that's a county-wide offering at no cost. And then they put in supports into the home for up to 8 weeks, sometimes longer, depending on available resources. And they also have other resources for parents. A lot of counties, I don't know if it's all, but I think many of New Jersey counties have a kayak, which is the Children's Interagency Coordination Council. So it's CIACC. And that is a great hub. It's where providers and parents both come together and meet monthly to discuss resources or lack thereof. That's a great resource for parents. And again, in the spirit of destigmatizing mental health, talk to people. I would venture a guess that more often than not, if you share with a friend or a colleague and say, my child is struggling, they're going to know someone, know somebody, have a connection. But if we don't have these conversations and we stay silent, then stigma will persist. And we're never going to know where to turn. So that would be my advice.
So someone asked about mental health first aid. So Robin, thank you for your question. We will take note of anyone who reaches out to us either via the chat box through this webinar or following today's webinar. You can reach out to any of us at the Quality Institute. Our contact information is also on the toolkit. We'll kind of just keep track and we'll talk to you about when those trainings can happen. But Shelby, do you maybe want to talk about, or Tara, how do folks find out about other mental health first aid trainings that are happening?
I mean, I can speak for Bergen County. We have a wide range of providers offering trainings, as well as the county itself. So I would suggest at least reaching out to the county mental health administrators who could point people in the right direction. I know on the national website, sometimes it will identify local trainings that are available. But sometimes, like when Bergen County is offering it for free, it's not posted on the national website because it's really intended to serve our local residents for those trainings.
So your county website might be a good place to also look, and the Mental Health Association of New Jersey often has these trainings as well, and they do post them on their website and on their social media channels. So those would be other great places to find information. But again, feel free to contact us at the Quality Institute. I see quite a few more questions coming in, so I'll just grab another one or two here. For communities that are interested in partnering with us, as we mentioned, we'll be working with 3 communities. We're going to launch an application in June. It'll be a short application that the mayor or the Mayor's Wellness Campaign Committee will have to complete, but we will keep track. Again, I'll take down the names of folks who said they're interested, and you can reach out to us afterwards, and we'll make sure that you get that information in June. Let's see. Some more mental health first aid training questions that we will be sure to connect with folks about. I know there was just one question here I wanted to make sure I ask, is that LGBTQ and BIPOC communities have a higher prevalence of mental health disorders. They're asking if there's Mayor's Wellness Campaign programs or maybe other programs that address these disparities specifically. Shelby and Tara, or even Mayor Riggs, do you guys know of programs that are specific for this population?
Yeah, the Trevor Project Lifeline is one resource. It's an 866-488-7386 number. So there's definitely resources customized for certain populations of individuals, from veterans, LGBTQ community, children versus adults, and so forth. So I know we tend to share a list of different types of specialized, because it's even some Korean group versus another group. We tend to share those kind of links on our website and in our toolkits, and I'm sure that local folks do know of others, but Trevor Project is a big one around the nation, and Born This Way Foundation too.
There's also GLESEN, GLESEN, PFLAG, parents. It's also for parents and their children who are identifying with being members of the LGBT community. gay, I'm trying to think of the organization. I'm sorry, because that caught me off guard. So I didn't have my resources
Well, you know,
available.
Tara, if you want to send them to me, I'll be sure to include it in the follow-up email.
Because there's many, there are. So these are great questions. I'm also nervous because I'm late for a meeting. So, you know, I want to hang on and answer, but I'm happy to, if you email me, I can certainly give you more thoughtful answers after the fact.
Great, thank you. And real quick, I know somebody asked a question about liability for connecting volunteers and seniors. And so a first step would definitely be to consult your municipal insurer. There are waivers that you can get for this. There is information on that in a link in our toolkit. So I definitely encourage you to refer to that if you're looking for information on liability. And so to conclude today's event, we had a couple more questions, but I will follow up privately with those just because we're a little over time. So I wanted to thank our wonderful speakers today and all of you for joining us today. A special thank you again to the Horizon Foundation for New Jersey for their generous support of our Mayor's Wellness Campaign mental health initiative, including the development of our mental health toolkit. Please remember the Quality Institute is here to support your Mayor's Wellness Campaign and the important work you are doing in your community. We are always available to speak with you and your partners, and we look forward to continuing to work closely with you in the coming months. Thank you and have a nice day.
Thank you.
Thank you.